Hey guys, it's Jeannette. Hope you're all doing well. I hope these last few videos have helped you prepare for an interview, what to expect once you're hired. And now let's just talk about orientation, meeting a preceptor, and working your first week as a nurse. So at the end of the orientation, for me, the critical care educator came by, introduced herself, and gave me this binder. So I thought I was done with paperwork. Apparently not. So this binder is full of unit information, rules, my schedule, the skill checklist that I should be completing with my preceptor contact information, any classes that I was enrolled in to attend during my orientation, as well as daily sheets to do on the patients that I take care of. I don't know, there's just so much. So at the end of the orientation week, which for me would be 12 weeks, unless we both feel that I need more time, the entire binder should be pretty much filled out. And this is a great way for you to remember the patients that you've taken care of. They'll review it. I have to look at policies that kind of pertain to the patients I'm taking care of, which is great because it gives me something to read and learn more about. My preceptor also looks at the skill checklist, and we kind of use that to also look for more opportunities with other nurses that I can go help, so I can get some of those skills checked off. So every single day that I go to the unit, I bring this binder, and that's what we use to complete my paperwork for that day. On top of that binder, I do have this notebook, so anything that I need to write down, I'll put it in here. And I normally make notes when I go through my shift assessments, like in the documentation system, and I may be forgetting something, or maybe I'm wording something a little differently than what they're used to, so I'll just make notes there. On top of that, I decided to carry one of these little mini notebooks that fit right into your scrub pocket, and whenever I'm on the go, I can pull it out, make notes. I've used them a lot for when taking vital signs, temperatures, also like glucometer readings, especially if you're going between patient rooms, and I'll write the room number so I know the time that I'm taking those numbers down, and then I take it out to the computer, and if I'm going to chart outside of the patient's rooms, then I can use that there. So I always love having a little piece of paper. And so in my orientation binder, my schedule was in there, and on the day that I was scheduled, you would just go to the unit, and this is information you should have gotten: what time you need to arrive, what time you need to punch in, what's the latest you can punch in, or you're considered late. So obviously I was there early, and I already had met my preceptor because I worked with her as a student. If this is your first time in the facility, during the actual getting assignments, they would probably ask you, do you know who your preceptor is? And you'll say yes or no, and then they'll introduce you at that point. They are expecting you. They have talked to them prior to your arrival, so they know that you are with them for however long they set you guys to be. So my preceptor is pretty cool. I love her, and she took everyone's attention for a minute. It's like, hey, just want to let you know we have a new grad. Her name is Jeannette, welcome her, and that's it. So that was good because at least people were introduced to who I was, and not just a stranger in blue. But I think that was a great icebreaker, just so people know my name, and I can kind of look around, smile, and just feel a little welcomed on the unit. So looking back at week 1 working as a nurse, there were obviously a high level of anxiety, but I think one of the biggest things that I need to tell you guys is, by this time, especially if you're working with your license versus your temporary new grad license, if you're working with your license, your preceptor is going to treat you differently than how you were in nursing school. And that's probably one of the biggest things that I kind of didn't get ready for is, I'm a nurse. I have a license. I passed the board exam. Therefore, they're not going to treat me like a nursing student. Yes, there are times where we have to educate and walk me through a lot of things like in nursing school, but to the public, to the patients and their families, I'm in the same color. I have my license. I just lack working experience, but I'm working with another nurse. So remember and remind yourself that you are a nurse, which, like, when I was wearing my badge and I saw RN, it kind of helps me feel more confident and, you know, go in and, you know, feel like I belong in that room. I belong taking care of my patient. And that's a little different to feel when all you know is nursing school. Overall, like, for instance, med administration, and, you know, I would look it up and I would make notes, and she's like, okay, go ahead and give them their meds. And I was like, by myself? You know, like, it could be an aspirin. And I'm like, okay, so yeah, I am licensed to do that, you know? So it kind of is something different to get used to. A lot of the learning curves, and this is where I think residency programs are going to do great, but I also have a different opinion because I am not in a residency program. My 3 partners in my study group are in residency programs, so they have more lecture classes alongside their working schedule. So hear me out. Great, I think they're going to prepare the new nurse. It's definitely, I think, an advantage, a benefit, but for someone who I feel like I did a good job during nursing school and I knew my limits, you know, never ever not ask a question. So in my mind, I came onto this unit. I am brand spanking new. I'm here to learn. I will ask questions and just have that, you know, mentality. I was thinking back is, I don't know how to express this, but you need experience working with an actual live patient. Doesn't matter how many times they want to do it in the lab or a mannequin. It's something about being in the room with the live patient, connecting, you know, IVs, putting IVs, you know, changing fluids. There's just a different sense of experience that when you're working with a patient, it's different than when you're in a mannequin. And part of me is like, you can tell me how to do this in a lab all you want. It will not help me overcome the anxiety when I have a live patient. And my example for that is, let's just say, you know, they have maintenance fluids running and you're asking me to piggyback, I don't know, another drug or something like that. You know, it's easy to do that. Okay, remember the fluids go, you know, lower and your piggyback is higher and all that stuff. But when you have an actual live patient and let's say it's, you know, a drug that could really, like, you know, potassium, you know, like the anxiety of just doing that with the live patient, or let's say family members are watching, the lab doesn't really help me. So for me, I need a lot of, like, in the patient's room, hands-on experience, because I feel like I have learned the steps I need to make and take in the lab, but just doing it with confidence in the patient's room is just more important. And that's really what's going to have that stick in my head and make me better. So I say all that to say, if you're in a residency program, that's great. If you're not, you can still learn and do your very best. So my battery is dying. So overall, I'll wrap it up. Just FYI, I did a post on Instagram about lunch. Bring your lunch, especially for that first week, so you can kind of socialize. You will have more time if you bring your lunch onto the unit versus going to the cafeteria and wasting all that time. You only get 30 minutes, depends on where you work, but for the most part, it's 30 minutes. And just stay positive. Make sure that you iron your scripts before. Get to your job earlier. When in doubt, ask questions. Make sure you're following your punch in, punch out rules. And overall, stay confident. Make notes. I made a lot of notes of things to review so I could prepare myself for week 2. Oh yeah, use Nurse Grid. That's an app that a nurse told me to download, and I was like, oh, okay, what is it? So you get to put all your scheduled dates, education dates in there, your pay dates. And I thought that's pretty neat because that's how I look up when I am working. Hope you like this video. Don't forget to comment, like, and subscribe, and share the videos. Bye.